What are Librela and Solensia? Librela, bedinvetmab for dogs, and Solensia frunevetmab. For cats are monoclonal antibody drugs targeting nerve growth factor, NGF. NGF is a critical biological protein involved in pain signaling, nerve survival and repair, immune system modulation. These drugs work by binding to NGF and blocking its interaction with receptors, reducing pain perception. However, they do not treat the underlying joint disease, they only suppress pain signaling. Core mechanism: why NGF matters. NGF is not just a pain molecule. It plays a central role in maintaining sensory neurons, supporting autonomic nervous system balance, regulating inflammatory cytokines, locking NGF alters neural signaling pathways, neuroimmune communication, tissue repair signaling. This is where benefit and risk intersect. Documented adverse effects, regulatory data, neurological effects. The FDA has identified ataxia, loss of coordination, seizures, weakness or paralysis, urinary incontinence, recumbency, inability to stand. These are central nervous system and peripheral nerve-related symptoms. Mechanistic concern: blocking NGF may interfere with nerve signaling integrity and repair, potentially leading to dysfunction. Musculoskeletal damage, emerging major concern. Recent studies show ligament and tendon injury, polyarthritis, fractures, accelerated joint destruction, reported approximately 9x more frequently compared to other arthritis drugs. Experts concluded strong suspicion of a causal association with joint damage. Key hypothesis: pain suppression, increased activity, structural damage, progression unnoticed, systemic and general effects. Reported side effects include lethargy, loss of appetite, vomiting, weight loss, skin infections, increased thirst and urination. In some cases, death or euthanasia has been reported following adverse events. Kidney and metabolic signals, elevated bun kidney marker, increased urination and thirst, suggests possible renal stress, fluid balance disruption, hypersensitivity, immune reactions, vomiting, diarrhea, lethargy after injection. These may indicate immune system activation, antibody-related reactions, effects on the brain and nervous system. NGF is essential for neuron survival, synaptic plasticity, pain processing pathways. Blocking NGF may disrupt sensory neuron function, alter brain signaling, affect autonomic control, bladder movement. Post-marketing data confirms seizures, ataxia, motor dysfunction. This suggests neurobiological impact beyond simple pain relief. Cytokines and immune system imbalance. NGF interacts with inflammatory pathways and cytokines. Potential downstream effects of blocking NGF. Altered cytokine signaling, dysregulated inflammation, impaired healing responses. Although not fully mapped in pets yet, monoclonal antibodies are known to shift immune balance, trigger anti-drug antibodies, ADES, modify immune signaling cascades. This raises concerns about chronic inflammation imbalance, reduced immune adaptability, under-disclosed emerging concerns, pain masking structural damage. By removing pain, animals may overuse damaged joints, leads to accelerated degeneration, supported by reports of rapid joint destruction, increased fractures, nervous system plasticity disruption. NGF is critical for repair after nerve injury, maintaining neuron health. Blocking it long-term may reduce nerve resilience, impair regeneration, behavioral changes, reported in some cases, sudden lethargy, altered movement or personality, possible causes, neurological disruption, pain perception rewiring, long-term unknowns, limited long-term safety data, most trials short duration, post-market surveillance ongoing, scale of reporting vs risk, global data shows millions of doses administered, adverse events reported as relatively rare numerically. However, serious events still documented. Underreporting is possible in pharmacovigilance systems. Balanced context. Important for legal and factual clarity. Many pets experience pain relief and improved mobility. Regulatory agencies still consider the drugs effective when used appropriately, but safety signals are actively being investigated. Some adverse effects are serious and biologically plausible. Librela and Solensia represent a new class of biologic therapy that fundamentally alters how pain is processed, but this comes with trade-offs. Interference with NGF affects more than pain. Impacts may extend to brain function, immune signaling, joint integrity, organ systems. The science is still evolving, and caution, monitoring, and informed consent are essential.